Hi, welcome to the video series on StrokeHub fact sheets. This topic is on speech therapy for communication difficulties. How does stroke affect communication? There are specific areas in our brain that controls our speech and communication. If these parts of the brain are affected by a stroke, it can be difficult to understand what people are saying, speak, read, and write. These challenges may affect the way you communicate with the people around you. For example, it may take longer for others to understand what you wish to express. Depending on the parts of the brain affected, you may have one or more communication difficulties. Common difficulties include dysarthria. This is the most common issue. Dysarthria is a difficulty with speech production that is caused by muscle weakness or incoordination. Your speech may sound unclear, making it difficult for others to understand you. Next is aphasia or dysphasia. Aphasia is an impairment of language affecting the production or understanding of spoken language and the ability to read or write. This can include difficulties in finding the right words to say, forming sentences, or understanding what you hear or read. Next, apraxia of speech is a speech disorder that affects the planning of muscle movements used for speech. The speech muscles are unable to move in the right sequence at the required timing, resulting in difficulty saying sounds, syllables, and words in speech. For dysphonia, it is a difficulty with producing a clear voice. Individuals with dysphonia may have a strained, breathy, or hoarse voice. Some may also experience difficulties controlling their vocal pitch and volume. So how can speech therapy help? It includes the assessment and treatment of communication difficulties. Speech therapy can help improve communication and facilitate better interaction by retraining your speech and language function, teaching you specific communication strategies, developing alternative ways of communication such as gesturing or using communication charts or devices, and training a loved one or caregiver to support your communication at home. If you are observed by the medical team to be having difficulties with communication, you may be referred to a speech therapist at the acute hospital or community hospital. After your discharge, therapy may continue in the hospital outpatient clinics, in the community, or with home-based therapy services. You should discuss with your speech therapist to determine the most suitable option for you. What are the chances of recovery? Recovery from any communication problems is variable and often takes weeks to months. Your active participation is vital to the rehabilitation process. With regular practice and a supportive network of friends and family, the speech therapist will be able to work with you to develop ways for you to meet your communication needs. Here are some tips for recovery. Actively participate in speech therapy. Get your friends and family to attend therapy sessions together with you so they can also learn strategies to help you communicate better. Take every opportunity you can to practice communicating with others. Keep your speech simple by using keywords or short sentences. You can also ask one question at a time. You can indicate to others when you do not understand. You can use gestures or drawing to help support your communication where necessary. Join and participate in therapy groups available in the community, such as SNSA, who organizes stroke clubs once every 2 months. Stroke clubs are a platform for stroke survivors and their caregivers to meet, support, and learn from invited speakers on topics relevant to them, such as dysphasia. Another group called Aphasia SG is a not-for-profit organization supporting persons with aphasia and their caregivers. Aphasia SG runs various programs to provide opportunities for supported conversations, social interaction, and singing in aphasia-friendly environments. For more topics like this, please visit StrokeHub at www.healthhub.sg/StrokeHub. It is a resource guide for stroke survivors and their caregivers. It is also available via the Health Hub app. Thanks for listening!